Hi there. I hope you're having a fantastic day. Listen, are you controlling the fire within? Do you even know what I'm talking about? If you have about 20 to 30 minutes, I'm going to explain it to you right now. Hi there, I'm Dr. Appalraju. I'm a general dentist, been practicing for about 20 years now, but I also have a background in cellular molecular microbiology. And I found this area very fascinating. I want to share it with you and hopefully enable you to live a long and vital life. And that's really what it's all about. We all want to live for a very long time, but sometimes we forget with our day to day lives how to get there. We just sort of plod along. And I want to share some information with you. Some of it is new, and some of it we've known for many, many years on how to live a long and vital life. And it's not what you may think. Part of it is, not all of it. So, part of this information that I want to share with you is because there's just so much of information out there. Everybody has a phone or access to the internet and Dr. Google, and there's a lot of information on health and wellness, really vitality. And quite a bit of it is very conflicting. And when you have a lot of conflicting information, people don't usually act on it. They just do whatever they're used to. And unfortunately, that doesn't lead them to a great life. Unfortunately, it leads to a challenge that we're experiencing in the Western world, and that really is a lifespan that may not be as productive as people want. Unfortunately, we're living longer, but we're not as well and we're not as productive, and that is a challenge. And one thing I'm going to tell you is that most people are going to the gym and they're having a fantastic diet, hopefully, not too much junk food, but organic and antibiotic and all this sort of stuff, free meats, free range meats and all this. One of the challenges I will tell you as a practicing dentist is that you cannot be healthy. I'll repeat that. You cannot be healthy with a diseased mouth, no matter what your mother told you. So I'm going to share some information with you to give you a little background and hopefully maybe save a life. Maybe it might be yours. Maybe it'll be a loved one or a child of yours if you share this information. And you may have some family members that are dealing with some health issues, and many people don't seem to look in their own mouth and determine that maybe that's the source of their problem. So I'm going to try to share some of this information with you. Now, this is a sort of relatively burgeoning field, connecting the mouth with the rest of the body. Some of the information has been researched for many years, but a lot of it is coming up in more recent information and research, and you may see some of this when you go to your grocery store, perhaps. Now, before I start, I would like to say a special thanks to some mentors that have shared some information with me over the years. Dr. Tim Donnelly out of Kentucky. We also have Dr. Thompson in Detroit. I've heard them speak, and some of this information actually is from their presentations. And also Dr. Odiatu is a practicing dentist out of Toronto. But much of this information is out there. You just have to search for it. And I've been sort of on a quest over the last number of years, really intensively reading on various subjects related to health, wellness, and longevity. And I hope you'll find some nuggets that you can take away to benefit your own life. So I'm going to start with a little story. After moving from South Africa to Canada many years ago, I had the opportunity to go back to Africa and visit family who had relocated now to a different country. And when I got there, I arrived, and this was back before we have cell phones and all this sort of stuff. It was 1987. And when I arrived at my family's property, my grandfather greeted me as soon as I jumped out of the car, and he pulled open his collar and showed me his neck. And he said, "Look what I had done. I survived this surgery." At that time, he was 67 years old, and he had a procedure that was really quite dangerous at that time. And this is what I saw when I arrived. I actually took a film photograph. And if you look at this, he's got two scars down the side of his neck here. And I believe the procedure was a carotid endarterectomy, which is a bilateral, and it's very high risk. If he didn't have this procedure done, he probably would have had a stroke or died because his arteries to his brain would have been plugged. There was also a risk of doing that surgery at this age. And many of us don't think down the road when we are in our 60s, 70s, 80s. People are living much longer now, even into our 90s and over 100. There's a lot of centennials out there. But when we're younger, we don't always think about these things and what we can do to live a full, vital life. And fortunately, my grandfather had this procedure and he survived. And I had the opportunity to go back and visit in 2000. You remember that Y2K stuff? And this was celebrating his 80th birthday. And he lived a full and well life. Now, I'm going to ask you to just imagine for a moment that you are holding a lighter under your hand, or maybe a lit match, and it's about an inch underneath your hand. And what you're really going to notice very quickly is that it's going to feel uncomfortable. You may even have some pain if you hold it there long enough. And you're also going to notice that there could be some swelling, some redness, and if you leave it long enough, loss of function. And what that really is an indication of is what we call acute inflammation. And that's there to protect you, keep you safe. You may have remembered touching something hot as a child, maybe the hot stove or a hot light bulb, and you quickly get your hand out of the way. It's there to protect you. Now, I want you to just imagine that same lighter or match. If it was long enough, you moved it further down, about 6 inches or a foot down below, under your hand. Now, at this point, you might feel a tingle, maybe a little bit of warmth, but you're really not going to have any pain, any discomfort for the most part. And I just want you to imagine that sort of warmth being like chronic inflammation. And inflammation is really the root cause of a lot of health problems that we're suffering with. And I'm going to show you why this is important. And you may have seen this because Time featured an article a few years ago, and they're calling it the secret killer. And it's really the connection between inflammation in your body and a number of health concerns that we're seeing, many of them skyrocketing. And as this slide shows, inflammation really is the root cause of the chronic diseases that we're seeing, that we call them aging diseases. And many of them are listed here. And inflammation is really the root cause of many of these things. A lot of these won't show up when you're young because we have a lot of resources and we're very capable of battling some of these challenges. But as we get older, these things start to rear their ugly heads. And many people suffer with arthritis, diabetes, cancer, heart disease, all these things that are listed on that slide there. And they wonder why they got that. And certainly there's some commonalities that you're going to show you here. The next slide is really showing you some of the data. Inflammation is significant in various parts of our body, not only in our mouth, as I'm going to show you in a minute, but also related to cardiovascular disease. There's diets that are geared toward minimizing your risk of having inflammation. If you're a fast food junkie, have a lot of sweets, sugar is certainly one of the factors there, lack of sleep, and I'll discuss a few of those things along the way here, while keeping this a relatively compact presentation for you. So as you can see, this is not new, and you may have even run across some of these particular books and magazines in your local grocery store. Arthritis, certainly. Alzheimer's is a big concern right now. It's skyrocketing in North America and most Western countries, and it is a big problem. And as you can see by these covers, this is certainly an area that most people are aware of, but a lot of people are not, and I'm trying to bring that awareness too. Now, how does dentistry fit into this? And really, dentistry is part of overall wellness. And many people visit their dentist at least once a year, often twice, sometimes more times. And quite often, this is the connection between dentistry and medicine, because many people don't even see their doctors on a regular basis. A lot of people don't even have a family doctor that they should be seeing on a regular basis, but we do see our patients on a pretty consistent basis. So sometimes this is the only contact people have with a professional. Now, I will share a story with you because I had the opportunity a couple of years ago to go to a children's birthday party where there were a lot of kids, and it was quite fun, but I had the opportunity of talking with another healthcare professional, and this gentleman was a pediatric physician or a doctor who specializes in managing kids. and just some general conversation during this business party, kids party. And what I found was that this gentleman had a health condition that he was probably unaware of. And it does seem to run a little higher risk in Asian populations. And nonetheless, one of the things that I realized was that he had gum disease and he probably didn't even know. And if you're a dentist or a hygienist and somebody has gum disease and it's a little advanced, there's this very particular odor that will come from the mouth when people speak to you. And sometimes family members may notice it as bad breath, but it's a little more significant than that. It has a very particular odor. And certainly I noticed it with this physician. So here was this gentleman that was taking care of kids and running a practice and managing all these things. However, he wasn't probably taking care of himself. He maybe did not go for regular dental care. And quite often, what we've seen over many, many years is that a lot of things in dentistry don't always hurt. And unfortunately, there's consequences to some of these challenges. Diabetes, high blood pressure in the medical side also don't always hurt until there's some damage, and people don't always take these seriously. And it's a concern for us long term, especially if you want to live a long, vital life. So this gentleman had what we call halitosis, but really more significantly, he had gum disease, and that was concerning. And we see this all the time in our practice. And how does dentistry connect to the rest of your mouth? So I'm going to show you that right now. And quite often when you go to the dentist or you hear some public advertisements, usually they're talking about brush and floss your teeth. And as you can see by this image right here, what we're looking at is the bacteria that builds up around the gum here. I call them billions of minions. We can't get rid of them. There's very, very many species in the mouth. Many we can't culture or grow. We can test for some of them. And the ones that are high risk for certain gum-related problems, we can certainly test for now. And it's not what's happening here as the slide shows. I will play this.
It is impossible for toothbrushing, flossing, or even mouthwash to penetrate more than 2 or 3 millimeters into these pockets.
So basically what this is saying is it's not what's sitting above your gums, it's what's going on down below. And most people can't see this in their mouth. And bacteria in your mouth, bacteria, fungi or fungus, and sometimes some viruses, they're in your mouth. And some of them are good, some of them are bad. And when the balance tips, it's not good for health because we'll start to see some changes in the mouth as a oral health professional. And these bacteria, we cannot get rid of them no matter how much brushing or flossing or mouth rinsing you use. Even if you go to your healthcare professional, their role is to reduce the number of these bacteria in certain areas in your mouth. Our goal is not to remove them all. In fact, it's probably impossible to remove them all because they reproduce so quickly. Even if we were so talented, we could take all these bugs out of your mouth and get down to one. Overnight, you'll have billions again because they exponentially multiply. We can't get rid of these guys, and they're definitely there to stay. So the important part to note is it's what's happening below your gums, and that's the key. So as the slide shows, it's a mindset shift. And it's not only about brushing and flossing and mouth rinsing anymore. As the slide shows, if you look at this image, this is a tooth, and this is bacteria, this small, fine material over here. This is actually the gum structure, and down in the middle right here, this is the bone, and this is tartar. Quite often, we call it calculus or tartar. You'll often see it on the inside of your lower front teeth, that yellow-brown material. If you drink coffee, it'll stain, more of a dark black type sort of brown color, but that builds up on your teeth and attracts more and more bacteria or those minions I mentioned earlier. The challenge is that what's happening here with this, we call it a biofilm, okay? It really creates a inflammatory host response. So your body is trying to protect you from these bugs and it doesn't want them to get into your bloodstream. That's the key. And if it does get into your bloodstream, then we see a systemic response because these bacteria will go to different areas. It's not just the bacteria, it's also their products, okay? And so it's a change of a mindset. It's not brush and floss, it's also get evaluated for this. And that's the significant change. So as the slide shows, these are bacteria, billions of them attached to the tooth surface, usually around the neck. And as they build up down here. We can't get rid of them. We start to lose tissue, not only the soft tissue, but the bone and the supporting tissue. And our body sends the warriors, the white blood cells, and these are responding to this bacteria typically. And what it does is it causes damage to the supporting structures around your tooth. And if you notice bleeding blood vessels or bleeding gums, that's really inflammations because your body is fighting to protect itself from the bacteria they're trying to invade. Unfortunately, part of this effect is damage to those tissues. And as the slide would show, bacteria not only get into the tissue, they will also get into your bloodstream, and from there, they can get anywhere in your body. And really, this is inflammation dependent. So once this gum disease is present, it does not magically go away. You need to be evaluated for this by your healthcare professional, either your dentist or your hygienist on an ongoing basis. It's not sort of once in a blue moon, because this is a serious health problem for a lot of people that we see, and we're educating our patients. Really, our goal is to bring dentistry into the mainstream with other healthcare so people understand the importance of taking care of their mouth and their dentition or their teeth. Now, I'm just going to have you imagine for a moment this, and this is a slide showing the palm of a hand. And if you just imagine you had a large ulcer in the middle of one of your palms, equal to the surface of that white circle, and it was bleeding, you would probably be pretty concerned. You'd probably take the day off work and go and see your emergency healthcare professional or a doctor, okay? And this is really, in reality, the size of surface area of your teeth in your mouth when you relatively have a full set of teeth and when you have what we call moderate to severe gum disease. So this is inflammation that's happening in your mouth. It doesn't hurt, unlike having a large ulcer in your hand, which would really hurt, and you would really notice that. You'd probably take some pain medicine or put a bandage on that. Most people don't do that when it comes to their mouth, unfortunately. Okay, and it's too late when this condition develops. It's very, very difficult to treat gum disease as it progresses, and as you saw that slide before, as you lose bone. But it's much, much easier to treat earlier. It's a little harder to detect early as well. So this is where that regular, consistent care comes in, and those checkups, okay? And the next slide, this is not new, and what the connections I want to bring to light for you related to your mouth and the rest of your health. And these are peer-reviewed journal articles that were written by various people, and they're talking about the connection between, it says periodontal, which means gum and the surrounding tissues of your teeth. So if you just imagine gum associations with cardiovascular disease, that's heart attacks and strokes, and also related to controlling blood sugar in diabetics. A lot of diabetics who have blood sugars that's out of control, it's important to get your oral health under control, because you won't be able to manage your blood sugars, which has serious health concerns, sometimes with just medication if you have an unhealthy mouth, because the inflammation in your body is much higher and you can't get that sugar under control, as well as adverse pregnancy outcomes. It's been shown that there's connection between unhealthy mothers' mouths and the health of their newborn children, okay? Also, the connection between rheumatoid arthritis, cancer, and also on mental status on many patients. These are all inflammation-related conditions, and what we take care of is the mouth. And so, not to surprise you with this whole talk, but your mouth doesn't exist in isolation. You certainly need to take care of it and have regular evaluations for gum disease. So your mouth is definitely talking with the rest of your body. We often say in our practice, the mouth is the gateway to your overall health. Without a healthy mouth, doesn't matter what you're doing, you can't be healthy, okay? So you don't go to the gym once and expect to be healthy for the rest of the year. It's the same thing with your oral health or any other health matters for that matter. But today, just talking about oral health, you do have to brush, you do have to floss, and adjunctive care such as mouth rinses are useful. But the key is you have to be evaluated for gum disease and the beginnings of gum disease, which is typically bleeding gums. We call that gingivitis, okay? And what's the connection here for you? Well, all of these things are connected to inflammation. So if you're highly stressed, if you have high blood pressure, if you smoke, if you have sleep apnea or sleep disordered breathing, if you have a large midsection, obesity is really an epidemic. It's not a pandemic, it's an epidemic right now. But if you have that, that tissue is not just sitting there quietly. It's releasing a lot of inflammatory products. Certainly diet is a big factor, but now I want you to consider gum disease as part of these. These are significant risk factors for having inflammation in your body, and the consequence is unhealthy health down the road, not being healthy down the road. And unfortunately, in our modern world, this is quite often what we deal with. Many people want a quick fix, and typically they will turn to medications or surgery to solve their problems. There is a better way, and certainly that is taking lifestyle factors into consideration and changing your lifestyle, having more sleep, drinking more water, a better diet, less junk food, less sugar. These types of things will certainly help you live much longer and reduce inflammation in your body. So the point is, dental care is no longer just about cavities, your smile, which is important, certainly psychologically for confidence, or whether you brush and floss. It's really about inflammation. That's the key point I wanted to drive home, and that's really the fire within. And this is why it's critical that you be evaluated on a regular basis. And again, just a review, systemic inflammation, which leads to heart problems and uncontrollable diabetes and Alzheimer's, and convalescence in an old age home. It's certainly related to what's happening in your mouth. We call it a bidirectional association or communication. So there is connections there. And certainly I mentioned Alzheimer's earlier, and this is a disease that is skyrocketing, could potentially bankrupt countries because of the costs involved in managing people who have Alzheimer's and the damage it does to families and caregivers. And as we can see on this slide, it is increasing roughly over 60 to 70% year on year, and much, much faster rate compared to heart conditions and diabetes and all these sorts of things. It's increasing at very, very rapid rates. So point being, dentistry and medicine do need to collaborate in order to control and manage some of these conditions. We're partners, and managing your sleep, certainly with sleep studies, and your blood sugar, and health choices related to health initiatives, tobacco use. These are all connections between dentistry and medicine. And we want to make sure we're certainly taking care of those areas. And we have had patients that have had multiple medications for blood pressure, for example, and were not being treated for sleep apnea, and their blood pressure was not coming down. Same thing with patients that have diabetes. Those that have unhealthy gums find it much harder to take control of their blood sugars. Okay, so I hope some of this has been hitting on you and certainly clear, but this is the connection again. The common factors that are binding all of this is chronic inflammatory periodontal disease, or gum disease, basic term, okay? And again, when you go to see your dentist or your hygienist, the least important thing that we do is clean teeth. We're managing all these other conditions that certainly can affect you long term. And one thing I didn't point out, which is shown on the slide, is vitamin D. It seems to be quite low in people who live in northern hemispheres, where winter takes a lot of the year. 6 months is winter. So make sure you're taking some vitamin D supplements, because we don't get enough sunlight. And that is very important for bone metabolism as well as health. So when you go to see your doctor, unfortunately, that tongue blade exam doesn't reveal gum disease. As you can see, we've got some specialized instruments here that help us as dentists and hygienists. And when we measure around your teeth, if we touch your gums, they should not bleed. Unhealthy gums bleed. And if you have one spot of bleeding or two, probably you have inflammation right now. So the key is not only do you brush and floss, More important is, when were you last seen by your dentist or your hygienist and had your gums checked? Okay, that's kind of the key I wanted to drive home for you. And there's a couple more articles here relating a two-way association between gum disease and systemic disorders. And there's another one here, a more recent article connecting gum disease with the development of blockages in the heart. So atherosclerosis of coronary vessels, which would lead to heart attacks. And we don't want anybody to have heart attacks, and certainly taking care of your mouth is part of that. And you may have seen some of these products at your local grocery store. These are some of the big companies that are realizing that gum health and gum detoxify and these mouthwashes, they're all targeting this area because they do realize it's connected to the mouth. They do a lot of research in the background, and then they come out with these products. On the left side here, you will see this is an indication of biofilms, okay? So these are things that are stuck on your teeth, in the mouth, and on the soft tissue, including your cheeks, your gums, the roof of your mouth. And lastly, we're not sure 100% if these are transmissible. The science seems to be pointing in that direction. So if you have gum disease and you have a partner that does not, you may be able to pass those bacteria to them. Now, how their body responds is going to determine whether they get gum disease or not. Kids also, and pets. So what we do see is that some of these things are vertically transmissible, meaning we're not born with them often, but we do get them from family members. So sometimes these will run down family lines, and the only way to be assessed is to be seen by your local healthcare provider. So finally, I appreciate you. Thanks for coming and watching this video. If you want to find out if you have gum disease, see your oral healthcare professional, meaning your dentist or your hygienist. They can help you and guide you to have health and vitality in the mouth, reduce your overall burden of inflammation, and hopefully minimize the chance that you'll develop any of these other health concerns later on in life when you want to spend time with your grandkids and enjoy your time in potentially retirement. If you have any questions at all, contact our office or contact your local dentist and get in for your regular care. It's more important than you think. I appreciate you spending time with me, and I hope you found this information useful. Take care, stay safe out there.